Here we go. Welcome everybody to another episode of The Big Idea. I'm Dr. Jeffrey Hanna here with Clear Chiropractic, where we talk about the big idea, how it is that a little vertebra where your head meets the upper part of your neck can have a big impact in terms of your health, your well-being, and can change your life. And this is a very important video. They're all kind of important, but this is a big one on one of the most common conditions that human beings experience. Vertigo, specifically what's known as benign paroxysmal positional vertigo, aka BPPV. And as a brief summary, if you don't want to watch the whole video, and that's okay, BPPV is oftentimes believed and is attributed to a dislodgement of the crystals on the inside of your ear that are sending messages to your brain about knowing where your head-body balance position is. The problem with that is that you can't really determine, based on an MRI or other tests, that that is actually what's going on. It's what's considered a diagnosis of exclusion, the idea being that you can tip the head at certain angles, and that seems to trigger the vertigo, and so it's believed to be caused by these inner ear crystals. However, when I see those procedures done, including what's called the Epley maneuver, very, very effective, I don't actually see something that is repositioning the crystals in the inner ear. I see a procedure that's actually helping to mobilize the joints in the upper part of the neck. And if you're able to resolve the problem in the neck, that is actually, as an alternative explanation, determining what is actually going on. In other words, BPPV is not necessarily an inner ear issue as it is actually a neck issue. So what we're going to do in this video is we're going to break that down and explain how it is that that is possible. So first and foremost, an overview of the story. We go through life and we experience any number of physical injuries. Slips, trips, falls, sporting accidents, car accidents, any number of different things where we don't necessarily think that there are any broken bones, there's no bleeding, and so we're fine. But there can still be damage on the inside. And in particular, the joints of the upper neck, this represents the weak link in the chain. And when we have injuries that may cause these vertebrae to offset and to lock in a slightly abnormal position, something like this that I'm showing you right here, what that does is that starts to create tension in the upper part of your spinal cord and in the lower part of your brainstem. And this is not going to be a good thing. Fortunately, our body has built-in innate adaptive mechanisms where it's going to try to compensate for this. And what it's going to typically do, there we go, is it's going to cause a shift. It's going to cause a change in your body's posture. You start to see tension, tightening down the body. One shoulder raises up, one hip shifts to one side, the head rotates a little bit like that. And the stress is absorbed into the muscle. The caveat with that is because we continue to go through life, these little problems can accumulate. Think of it to a certain degree like unpaid compounding interest. Even a 1% value multiplied over months, years, and decades can accumulate and cause a lot of additional stress, strain, and tension through the muscles, then into the ligaments, and then into the nerves themselves. And it's at that point where people seemingly start to experience things that they've never had before, and they put it down to stress or genetics or just getting older, any number of things that is not necessarily true. The reality is that this is a very old injury that has been accumulating over a long period of time, if you would, a slow motion injury. And it can show up in a lot of different ways when you're dealing with an issue at the top. Headaches, vertigo, dizziness, jaw disorders, other types of facial issues. It can show up in body issues, including sciaticas, carpal tunnel syndromes, fibromyalgias. There's any number of different combinations of things that can be going on, because ultimately this junction right here is the master control center for every function that goes on in your body and influences every muscle, organ, tissue, and cell in your body. And so what our focus is then as upper cervical chiropractors is we are looking to see, are these kinds of undiagnosed issues going on With the alignment, motion, stability of the upper joints of the neck, we identify the exact location, direction, degree of that misalignment. And when we know that, the procedure is more of an unlocking. It's not a twisting, it's not a cracking of the joints. It is a correction so that your body can do what it is designed to do, that is heal itself. And it's able to then unwind that, and then we see the byproduct of the restoration of that normal life flow where people are able to experience relief and ultimately move toward a higher level of health. So that's the big idea in a nutshell there, and also the story about how it is that many times when people experience issues later in life, it's actually as a result of something that happened a long time ago, on the average 10 to 20 years. All right, so let's get into it on the topic then of BPPV. I've been saying for a long time, and I've done other videos on this, that BPPV, I personally don't believe that this is an issue of the inner ear crystals being dislodged. And I have based that on the fact that you can't see the crystals on a particular MRI. If a person was able to have a brain MRI and it was sufficiently high resolution and it would show, yes, the crystals of the inner ear are supposed to be sitting here, but there it is, it's dislodged, I'm not going to argue with that, with the evidence and the science that's in front of me. But the fact that we can't see these things tell me that this is a functional neurological disturbance of some type. And so what I did, out of a little bit of interest, is I went into ChatGPT. And ChatGPT does not have all of the answers in the world. I do not, download all of that and take it as gospel. It nevertheless, represents a summary of all available information. And so you can use it to ask a question, and then it gives back a good broad overview summary, saves you a lot of time of research where you're able to find the individual citations. But don't worry, we'll go back and find some of those citations. So here's the question that I asked. Is there proof on an MRI that BPPV is caused by crystals? And here's what it says. BPPV is primarily diagnosed based on a patient's clinical history and specific characteristic symptoms, such as brief episodes of vertigo triggered by certain head movements. While an MRI can help rule out other potential causes of vertigo, it typically does not show evidence of the dislodged crystals, aka canaliths, directly. So what this means is it means that the concept and the common belief, the common accepted belief that BPPV is caused by a crystal dislodgement is actually a hypothesis. It's a belief. Now, it's based on, as they've just said, clinical findings. And that is that a person's vertigo typically gets worse when they lie down, but that by doing certain kinds of head movements, what's called the Epley maneuver, or actually it's more appropriately Epley maneuvers, because there's not just one Epley maneuver based on what's going on, that by doing certain movements with the head in a certain sequence, what it does is it helps alleviate those symptoms. And the belief is that by doing those movements in a certain direction, the crystals are then able to be repositioned into the normal spot where they are designed to be, and as a consequence, a person is able to get their balance back. But for many, many years, when I have seen that maneuver performed, that's not what I see. Perhaps that's my bias, and that's, where I'm coming from clinically. But what I see is a person who's actually having mobilization done through the joints of their neck. And for many people, basic mobilization, so just self-directed or assisted movement, is enough to be able to alleviate the symptoms. However, there is nevertheless a significant percent of the population where A, the Epley maneuver, simply put, doesn't work. Or B, it does work, but there are still recurring episodes. And at least to me, what that suggests that something else is going on in that circumstance, where basic decompression is not enough. Something is jam locked up. And I look at the neck, and saying, okay, it's probably jam locked up a little bit more than just simply a normal release with the forces of gravity. And that's where, from the upper cervical chiropractic perspective, can't talk, I look at the alignment of the atlas and the axis in particular because of their influence on the balance centers of the brain. And what I'm going to show you here is actually a bit of research that is supporting that hypothesis. So let's have a look at that. All right, here's what we got for you. Cerebral outflow discrepancies in recurrent benign paroxysmal positional vertigo focus on ultrasonographic examination. And I'm actually going to scroll through something here because I want to point this out that they have a little bit later in the article. A very, very important comment for people who do experience episodes of vertigo dizziness. Vertigo represents, after headaches, the second most frequent symptom reported by the general population, accounting for 8% of all cases seeking the attention of a general practitioner and about 3.3% of all visits to the emergency room. I've said this for a long period of time, that in my own clinical experience, headaches, migraines are the two most common symptoms that people come for help with, but vertigo is a very, very close number 3. In other words, it is one of the most common ailments that we as human beings experience, because oftentimes when people experience either dizziness or vertigo, and they're slightly different, not only different in terms of what a person experienced, but also slightly different, in terms of what is causing them, that people feel like they're alone, that they're the only person who is experiencing these kinds of things. And as a result, people are not very familiar with that case, their presentation, all that sort of stuff. And I actually want to dispel that myth right here. Vertigo being one of the most common things out there, especially what we see in the upper cervical chiropractic practice. This is something that we are very, very familiar with. And I know it doesn't in and of itself make that go away, but if you are experiencing vertigo of any variety, Meniere's, BPPV, labyrinthitis, cervicogenic vertigo, cervicogenic dizziness, whatever name you want to put on it, you are not alone by any stretch of the imagination. And I know that that can be very hard as well when, your friends, your family are wondering, well, you look fine on the outside, but it is absolutely debilitating. See, it is awful, and I take nothing away from this, as awful as a headache and even as a migraine are, to a certain degree, not always, but to a certain degree, you can push through that. But if you're hit with vertigo, it is impossible to block that out. Nobody can block that out when it strikes in that moment. But a lot of times people don't understand that. I just want to let you know, if you're watching this, that it's very common, you're not alone, and we've got a good understanding about vertigo and what can be done to actually help that out. So I just wanted to say that first and foremost. So let's then go back up to the top summary of the article here and describe what these guys did. So this is a prospective pilot study, so it wasn't a huge sample, but the percents are rather interesting. Aimed to evaluate whether cerebral inflow, blood flow going to the brain, and outflow, blood flow going back from the brain, abnormalities assessed by an ultrasound could be associated with recurrent BPPV. What they did was they took 24 patients and they used ultrasound to assess the blood vessels going to the inner ear and also the blood vessels coming back down from the inner ear. Here were their results. From the ultrasound, 22 of 24, 92%, were found to have one or more alterations of the extracranial venous circulation among those considered for the diagnosis of chronic cerebrospinal venous insufficiency. And none of the patients were found to have alterations with arterial circulation. What does that mean in English? What that means in English is that they didn't find that any of these people who were experiencing recurrent BPV had issues with blood flow going to the brain. They were finding that 92% of them had drainage issues. Blood flow was not going properly from the brain, from the inner ear, back to the heart. And the particular pathway that was affected on the side that they would experience the vestibular disruption was what's known as the vertebral vein. And this is a condition that can be lumped into a category of things which is known as a chronic cerebrospinal venous insufficiency. In other words, those veins are not draining blood flow properly. Now that is a very, very profound statement right there when it comes to understanding what the true origin of BPPV very well may be, that it actually is not a crystal issue, it's a blood flow drainage issue. And if that's the case, we then need to consider other possibilities in terms of what is causing this. So what I'm going to do now is I'm going to show you a few pictures that explain a little bit what the normal drainage pathways of your head and of your neck are, and I'm going to show you then how it is that a problem with the upper alignment motion stability of the joints in your neck actually affects that cerebrospinal venous drainage pathway. In other words, the problem may not be the inner ear, problem could be your neck. All right, so what do I have for you here? I have a little bit of a cluster of things for you on this particular illustration. And this is simply to show you that the veins in your brain are extensive. There is a huge network of things that are designed to drain blood from your brain back to your heart. And I'll break it down so it's ever so simpler to follow this, but just wanted to give you a broad overview that this is a very, very complex situation. There are nevertheless two primary pathways that we know that blood is returned from the brain back to your heart. The first one is what's known as the internal jugular system, and the second one is what's known as the cerebrospinal venous system. So let's go ahead, I'll make a little slide right here. Let's go first to the internal jugular system. There we go, that'll do for our purposes right there. So the internal jugular vein, this is the very, 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 very large pair of veins that are actually found on the, basically deep inside your skull, behind your jaw, and run in front of the vertebrae in the upper part of your neck and then returning blood back to the heart. This is a very, very large series of vessels and is actually the primary drainage pathway, but only under certain only under certain circumstances. And what are those circumstances? We know from the anatomy, and we also know from other research where we look at ultrasounds and we look at MRV studies, that when a person is in the lying down position, whether it's face up or face down, that these veins are the primary drainage pathway. But what we also know is that when a person goes from lying down to an upright position, these veins actually collapse. And it has to do with normal fluid dynamics and pressure. So what I'm saying there is that the internal jugular venous system is only the most active system when a person is lying down. When a person is upright, the preferred drainage system is that cerebrospinal venous system. So let me show you that. We'll scroll back up right there. There we go. So this is the cerebrospinal venous system. And what I'm going to illustrate here for you is that this is the one that actually is transmitting all of the blood flow from your brainstem, right through here, from your cerebellum, and also that deep and upper part of your neck at your brainstem right here. Now, why is that important? Well, your cerebellum is essential for muscle coordination, fine-tune movements. It's also essential for the normal function of balance and equilibrium. Your brainstem, amongst the many, if not all, functions that go on in your body, is going to be where those central processing centers are that are coordinating visual, balance, hearing, and equilibrium. It receives the information from the inner ear, from your eyes, and also from the joints of your neck. And this is where this information is being processed. And what it does then is it in turn drains out from the brainstem into these series of vessels along the very back of your skull right through here. It transmits through your spinal canal and then in and through a network of veins and down and through the upper joints of your neck. Now, as we already said, we said that when you are in the lying down position, this is not the preferred drainage pathway. This is the preferred drainage pathway when you are upright. And isn't that the issue where so many people experience vertigo or other kinds of symptoms? Typically speaking, and I know vertigo can sometimes be a little bit different, including BPPV, that, I feel worse when I lie down and when I move my head in certain directions. Well, if you have a mechanical obstruction of some kind, and I would use the example, and I'll grab a couple little models here to illustrate that. So we're going to zero in on the upper joints of your neck right through here. Those joints are normally designed to be sitting and moving in a certain way, but if they are locked in an abnormal position, what that can do is that can start creating torsion or a micro disturbance of that normal cerebrospinal venous drainage out through these vertebral veins. And it doesn't have to be that much, because if your brain needs to be draining 100% outflow, but it's down 5%, 10%, oftentimes on MRI or ultrasound, people will say, that's just a normal anatomical variant. Well, what if it isn't? What if these vertebrae are not sitting where they're supposed to? That then becomes a choke point. And as a consequence, the veins are not going to be able to drain properly out of your head. And certain movements then will make that slightly better and slightly worse, depending on the individual combination that you have. So this is again very common where people say, I can feel pressure in and through the back of my head, and I feel better when I lie down. That is a hallmark, a telltale sign that we are dealing with some kind of venous drainage issue that is impacting and most likely involving this particular area of your body right through here. But if, on the other hand, you experience vertigo, whether in the upright position here or even when you are lying down, why would it be that certain kinds of head movements make it better? As I just said, it's because those movements are very likely influencing that venous drainage outflow situation. And it's able to clear those obstructions, even if just momentarily, so that that blood flow can come back out of the normal, in that lying down position, internal jugular venous system. And as a consequence, by getting that blood flow back to a state of equilibrium, a person's symptoms then are able to go away. So what this means, in a nutshell again, is that when we do something along the lines of the Epley maneuver, or if a person's been diagnosed and experiencing BPPV, the problem may not be with the crystals at all. It may have everything to do with this microcirculation that is strongly impacted by those joints of the upper neck, because they represent a potential choke point for that normal drainage flow. Therefore, if what you do is able to restore that normal motion so that that outflow is able to go the way that it is supposed to go, you're able then to experience relief of those symptoms. Now, even that is not necessarily the full story. I've done other videos talking about how the muscles through the upper part of your neck that are normally positioned between the base of your skull through here, the C1 vertebrae here, and the C2, that if those vertebrae are ever locked out of position, they start to cause those muscles to fire. And those muscles are laden with what are known as muscle spindles. These are sensory organs that go to that exact same part of your brain, again, that I said are responsible for balance, coordination, equilibrium. So when we have the disruptions not like this, not only can it be affecting the circulation, but it can also be bombarding your brain with abnormal sensory and balance information that essentially overloads the circuit. And again, certain movements that you do where it may increase that distortion and increase that tension on your neurology, that will make you feel worse. But then movements that you may be doing either purposely or accidentally that take the edge off can make you feel better. And this is one of the reasons we believe it is that people say, my vertigo is triggered when I lie on my left side, but not on my right side. Or maybe my right side, but not my left. Or if I turn my head and look up this way, or if I look down the other way, it's because head position is the trigger. And that really should be the clue here. It's that if head and neck positioning is the trigger for your vertigo symptoms, it means that we should be looking at the alignment of the head and the neck as a probable origin of that in the first place. Again, I take nothing away from the significance of the inner ear. If a person's having a sudden vertigo attack, yes, you have to rule out the forms of pathology. Major blockages, bleeding, tumors, lesions. But if all of that is clear, we should not be so quick to just jump to the inner ear as the source of the pathology. We have got to look at the joints of the upper part of the neck because they are so terribly important in terms of a person's body function, balance, equilibrium, all that sort of stuff. And unfortunately, it is a severely underdiagnosed problem for so many people who experience these issues. And especially then, if you are simultaneously not only experiencing vertigo, but also experiencing headaches, jaw issues, shoulder tension, odds are these are not independent events. Odds are is that there is a common underlying cause. And if you can identify what that underlying cause is, that gives you the best possibility of finding a genuine long-term solution. So very important. Always look at the alignment, motion, stability of the joints in your upper neck for vertigo. So there we are, another one for the books. I hope you've enjoyed that one. If you do, there are always 4 things that we ask you at this point. Number 1, please do be sure to click that like and subscribe button. Number 2 is if you've got friends, family members who you think would benefit from watching this video, they're experiencing dizziness, vertigo, headaches, whatever that would be, whatever again the label might be, but they haven't had the upper neck looked at, please share this with them. Number 3 then is if you want more information, you can go to my personal website, which is drjeffreyhanna.com. We have all kinds of other blog articles, videos that talk about the relationship with the upper neck and how it shows up in so many different ways affecting, again, your health and well-being. And you can also get in touch with me there. I answer all of my emails directly. And then 4th, so last but certainly not least, is if you've been diagnosed, you're experiencing either BPPV, Meniere's, vertigo, again, whatever different form of it, and you haven't had this explored, you can reach us at our practice. So we're at clearchirospokane.com, or you can call us direct at 509-315-8166. We'll be happy to have a chat with you, coordinate a few things, and find out if there's something that we're able to do to help you out. Again, it's all about living a better quality of life. So thanks for watching this one again here. We look forward to hearing from you. This is Dr. Jeffrey Hanna at Clear Chiropractic Spokane. Get well, live well, stay well. So until next time, take care. Bye-bye.